Can hydrogen-rich water decrease inflammatory responses? You may have extra inflammation in your body if you have aches, pains, or swelling. Today's conversation discusses the anti-inflammatory effects of drinking hydrogen-rich water. So, where can we get hydrogen water? One place to look is to a water ionizer. A water ionizer is a special high-tech water filter that through electrolysis, as opposed to adding chemicals, produces drinking water with a higher potential hydrogen or pH, which also produces molecular hydrogen or hydrogen water. I have prepared this brief video describing both human and animal research studies supporting a type of drinking water that very well may decrease a source of excess inflammation in your body. Researchers studied the use of hydrogen-rich water in a July 2020 human, double-blind, randomized, placebo-controlled study that was published in the journal Scientific Reports by Sim and colleagues, describing that drinking hydrogen-rich water reduces inflammatory responses. The study discusses how hydrogen water was shown through its antioxidant effects to reduce inflammation. The study used RNA sequencing analysis, most notably transcriptional networks of inflammatory responses were significantly decreased in the group that drank the hydrogen water. These findings suggest hydrogen water increases antioxidant capacity, thereby reducing inflammatory responses in healthy adults. In a 2012 animal study from cardiovascular research by Sun and colleagues, they researched how drinking hydrogen water for 6 weeks post-surgery brought on a better outcome for those animals that had vein surgery as compared to the animals that drank non-hydrogen plain tap water. This includes significantly less adhesions, less vein thickening, and less oxidative injury for the hydrogen water group. In that same study, it was stated that surgical vein grafts often fail due to post-surgical thickening of the veins, called intimal hyperplasia. The authors proposed that because hydrogen potently protects organs and cells from many different types of anti-inflammatory and antioxidant properties, that drinking hydrogen water post-surgery may assist in a better outcome. Furthermore, the study states hydrogen functions as an important physiologic regulatory factor with antioxidant, anti-inflammatory, and anti-apoptotic protective effects on cells and organs. These effects help to protect the group of the animals that received the water. Basically, what that means is that they had less inflammation and there was less cell death after the grafting process. In summary, the cardiovascular research by Sun and colleagues described how drinking hydrogen water can prevent the development of what's called thickening blood vessels, or specifically intimal hyperplasia, by reducing oxidative stress, inflammatory responses, and smooth muscle cell migration. Muscle cell migration is like if you lift weights and thicken your muscle. This is an important point because the authors stated that approximately 50% of vein grafts result in intimal hyperplasia, which is a major cause of recurrent ischemia, which is less blood flow and less oxygen after the grafting surgery process. For example, this would be like taking a fire hose and cutting out a piece of it that was thickening or squeezing down, and replacing it with a different type of hose that after a few weeks thickened from the trauma of splicing in that new piece of hose and bringing it from the size of a fire hose down to like a garden hose. So it was a very good result. In a 2011 human study from the journal Medical Gas Research, Kang and colleagues showed the antioxidant effects of hydrogen water, titled Effects of Drinking Hydrogen-Rich Water on the Quality of Life of Patients Treated with Radiotherapy for Liver Tumors. In this case, the tumors were malignant. The methods of the study demonstrated a human randomized placebo-controlled study was performed to evaluate the effects of drinking hydrogen-rich water on 49 patients receiving radiotherapy for malignant liver tumors. The results: drinking hydrogen-rich water for 6 weeks reduced reactive oxygen metabolites in the blood and maintained blood oxidation potential. So this is an example of hydrogen water's antioxidant benefits. Also, the quality of life scores during the radiotherapy were significantly improved in the patients treated with hydrogen-rich drinking water compared to patients receiving placebo tap water. There was no difference in tumor response to radiotherapy treatment between the two groups. The author's conclusions: daily drinking of hydrogen-rich water is a potentially novel, something that hasn't been done before, and that's also one reason why you haven't heard of it, therapeutic strategy for improving quality of life after radiation exposure. Consumption of a hydrogen-rich water reduces the biological reaction to radiation-induced oxidative stress without compromising anti-tumor treatment effects. And those were the words of the author. Now, we have heard the results of these published studies. Perhaps we are able to help ourselves with antioxidant hydrogen water from a home filter that produces hydrogen. Hello, I do not believe we have been introduced. I am Dr. Thomas Walko. I have entered my 4th decade of practice as a doctor of chiropractic with a focus on natural healthcare, functional medicine, and clinical nutrition. I have seen thousands of patients with various types of pains. This is a Walko response presentation that I have titled, Can Hydrogen-Rich Water Reduce Inflammatory Responses? I have prepared this brief video expose describing both human and animal studies supporting a type of drinking water that very well may decrease a source of excess inflammation in your body. I am Dr. Thomas Walko with over 30 years of private practice and experience in functional medicine, clinical nutrition, and treating patients in pain. I am presenting this video for Walko Response, an organization that aims to reset your injury response. Today we talked about the anti-inflammatory effects of drinking hydrogen water via its antioxidant effects. So where do we get this hydrogen water? One place to look is to a water ionizer. A water ionizer is a special high-tech water filter that through electrolysis produces drinking water with higher potential hydrogen, which is called pH. And in doing so, molecular hydrogen or hydrogen water is also produced. I first heard of this water ionizer filter discussion over 20 years ago, and after researching them, I decided to buy one. I was glad I did, because that filter was a workhorse and helped my family as well as my patients with more problems than I can discuss here. Since then, I have continued to research multiple companies that make ionized drinking water filters. I have purchased a total of 3 different ionized water filters from 3 different manufacturers, and overall I've noted wonderful clinical results from all of them. But my personal research convinced me to continue to research, and I eventually purchased my 3rd and final water filter because I discovered it to be the most cost-effective, most powerful, and the most high-tech and simple water filter on the market. Again, the other filters work well with no clinical complaints, and they may work well for you, but my professional and personal experience has me recommending the Life Ionizer series of high-tech electrolysis water filters. In an article titled, How Much of Your Body is Water by Dr. Anne-Marie Helmisten, PhD, and published by ThoughtCo, cites a study from the European Journal of Clinical Nutrition, volume 64 in 2010, Water as an Essential Nutrient, the Physiological Basis of Hydration. And in that study, it stated that the average adult human body is 50 to 65% water, averaging around 57 to 60%. My recommendation as a practicing doctor for over 30 years is for Life Ionizer and their multi-stage barrier, chemical-free, ultraviolet light filter and ionization system. This is Dr. Walko. Thank you and enjoy.